The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, I'm Dr Amna and welcome to the Health and Fitness Show on Inspire FM. Thank you for joining us tonight on this pre-recorded show that's being broadcast on Thursday, the 29th of August 2024, where for the next hour we'll be focusing on your health and fitness. We are broadcasting here on 105.1 FM from Luton, and we'll also be on the Inspire FM Facebook page, and you can listen back to this show later on our new website, inspirefm.org, as well as on the Inspire FM app, on your smart speaker podcast player, or on YouTube, Facebook or Instagram. I'm Dr Amna. I'm a GP living and working here in Luton, and as you all know from all of the different shows we've done in the past, I'm really very passionate about women's health, female health, girls just having an understanding of their bodies and how it works and how it makes us feel and what things we need to prioritise to ensure that our health is as best as it can be as women. And today I'm very lucky to have a few different people in different roles across public health here in Luton that are also passionate about the same. Now, please do remember that we can't give out any specific medical advice. This is something that you have to see your own GP for. But for the next hour, we'll be given some general advice and signposting to some important services that are here in the town. Now, this is the first in a series of a couple of different shows that we'll be doing, but also some community events that we'll be running, some of which have already started, and we'll be talking about those a little bit later on, but also that we'll be running from kind of October onwards. So if you are listening today and you have any questions, any follow-ups from anything that we've discussed, anything that you want some clarification on, please do get in touch either via text or WhatsApp on 0777 948 1822, or contact us on social media at Inspire FM or at Dr Amna GP, and we'll make sure that we'll cover them next time. So we have lots of different really experienced people that I'm very grateful to have with us today. So we have 4 different guests, and I will introduce them all quickly now. So good morning, well, good evening, everyone, really, by the time this comes up and is broadcast. And I'll go through each of their roles, and they'll tell us a little bit about what they do as well and why it's so important to women's health here in Luton. Now, the first person that I have joining us is well known actually within the community, and she's one of the community connectors, and that's Anjuman Qureshi. Assalamu alaikum.
Wa alaikum assalam, Amina.
How are you?
I'm fine, thank you. How are you?
I'm very well today, thank you. Thank you for joining us. For those who haven't come into contact with you yet, can you tell us a little bit about your role?
Okay, so my name is, the name that we use is the Macmillan Luton Cancer Community Connector. The role's being created as part of a collaborative project with Macmillan Cancer and Luton Borough Council and other partners. So we look at how we can improve cancer outcomes for the most affected communities. So as connectors, we are working with South Asian, Black African, Caribbean and Eastern European communities. And our aim is to capture the voice through this research that we can use to inform and improve cancer services.
Excellent. Thank you so much. And that's really important work. We know how much cancer affects every single person listening. Everyone will know somebody that's been affected by cancer, and we want to improve anything that we can do to help pick up the rates. And we'll be talking about cervical screening specific to women a bit later on. Thank you. I also have Christina, who's a public health manager within the Health Lives team of Luton Borough Council. Thank you for joining us.
Thank you very much. Hello, everyone. Yes, my name is Christina Gleeson. I'm a public health manager at Luton Council. I work in the area of health protection, health inclusion, and now also inclusion health. So I work with specific groups in the town who face particular health inequalities and challenges to service access, etc., to meet their needs. So My day-to-day deals with outbreak control, management, emergency planning side of things. Whenever there's a health-related incident in emergency planning, I'd be involved there. And also some of the day-to-day immunisation programmes, so the school-aged immunisation programmes, any national immunisation programmes, such as HPV, etc. I would be involved and work with the wonderful colleagues in the NHS England, and UKHSA, which is the UK Health Security Agency.
Excellent, thank you. Now, some of that can sound quite scary to listeners. The UK Health Security Agency, you just said. But essentially that just means protecting our health kind of as a country, so on an individual level, and then as we're obviously focused on Luton, but as a wider community as well, and then the country as a whole. And vaccines are very, very important with regards to that, so we'll definitely be talking about the HPV vaccine in a few minutes as well. Thank you. Next I have Becky Twist.
Yeah.
Hi, Becky.
So yes, my name is Becky Twist. I'm the operational manager within the Hertfordshire NHS Trust, and we look after a number of community and school age vaccination teams across the east of England. And Luton will be one of our teams that is joining our group, along with Bedfordshire and Milton Keynes as of September. And what we do is we go out to all of the schools across all of our patches and offer school age vaccinations, whether that's flu, the diphtheria, tetanus and polio, meningitis and HPV, which is a very important vaccination that we're here to talk about as well today.
Yeah, excellent. So we've kind of done things in a bit of a strange order. So we've just heard from two very experienced colleagues that deal with kind of school age vaccinations. We've heard from Anjuman, who's the other side of kind of cervical screening, a little bit older, and we've got Sophie, who kind of deals with everything in between and above and beyond, and works with sexual health. So hi, Sophie.
Hi Anna, thank you for having me today. Yes, I'm one of the outreach workers at Luton Sexual Health. Just so you know what Luton Sexual Health is, because we do many things here. We're a free confidential NHS sexual health service as part of Bedfordshire Hospitals, but really important for people to know, I think, when we talk about sexual health, that we are confidential. All of our records are separate to any hospital records, even though we are part of the trust. And we are a sexual health service that offer contraception, STI testing, treatment and care, HIV prevention, treatment and care, and general concerns about people's sexual health. We offer lots of information and advice, free condoms. We're very lucky here in Luton that people over the age of 25 can receive free condoms, which is something signpost listeners to, and just a little bit about the outreach team, because we do a very specific role here in Luton. We are sort of here to engage and educate people within the community, outreach vulnerable groups, and we have a team of 4 of us, and each one of us has a specific specialism and area of expertise to sort of meet the needs of people here in the town.
Thank you. And that's really important, and that's actually I'm glad we kind of did you last, because then we can start with you first, because I think sometimes when we do some of these shows, some of the feedback we get is that actually, is this very relevant to the wider community? Is a sexual health clinic only for those who are married with kids? And if they're married with kids, then they're not going to have STIs, and therefore they will never need the sexual health service. And my response is always absolutely not. And this is why we need to be talking about this more and more and more, because actually everyone listening, sexual health is relevant to you, whether you are, I would say, whether you're sexually active at the moment, whether you have been, or you are looking to be. It's best to kind of be well prepared, correct?
Yeah, absolutely. And we do lots of work in schools and with young people around that specific need. And, working in Luton, we do come at it from a point of view of whether this is something you need right now, it might be something you need in the future. And I believe that information is power, and it gives people the decision and choices to decide on, what's best for them and what's best for their health. And we offer, like I said, lots of information and advice around healthy relationships, and signpost people to resources that may help them in that area. And like I said, free condoms, which, if people are married and have children, but maybe they are not wanting any more children, then the free condoms is a really important part of our service, and we offer.
And I think it's something that actually with the free condoms, because I've had a few patients come in, and when we've talked about sexual health, because I remember, you know, a good few years ago in GP surgeries, you would have some condoms, we would have boxes of condoms and we could give them out, but we don't anymore. And unfortunately, over the years, that's something that's moved away from general practice. But actually, that is something that is available and free, especially in Luton. At the sexual health clinic, which actually in these times where life is difficult, life is expensive, every little helps really, and having a baby is much more expensive.
Absolutely. And people don't have to come and collect them from us at the clinic. We have condom sites in pharmacies across Luton, and all of that information is available on our website. So if people would prefer not to come to the clinic, they can go to a pharmacy, their nearest pharmacy, which is really convenient and accessible. And we also deliver condoms by post. So we just have a condom phone that people can text into, and we deliver the condoms to them. So it's not like they have to come into the clinic to receive them. They are accessible from multiple sites.
Okay, well that's definitely a new thing that I didn't know. And what about kind of packaging? Because I'm sure maybe Anjuman will get these questions from people in the community saying, actually, you know, my family members don't know that I'm sexually active, for example, but I want to be safe.
Absolutely. So it's all discreet packaging. This is something that people do worry about. And they just come in a little purple packet, and they will come in a plain package box. So it doesn't say Luton Sexual Health. There's no branding on it either. Obviously, condoms are branded, but there's nothing else on the packaging that would suggest that it's sexual health related. And that's the same for our STI kits as well. If people want to order an at-home STI testing kit, I think people do worry that it will look like it's come from Luton Sexual Health, that will have information on the front that people know what it's for. But again, it's just a plain box that is discreet and nobody knows your business.
Yeah. Good. And I know, Anjuman, you've had lots of different events out in the community in different areas to kind of get people talking about these things and being aware of the different services that are available. Are there any events coming up, or can you let us know about some of the events that have happened recently?
So we've had a number of events. We started our project with World Cafe, which was getting all the organisations aware of our project and our launch of ER, and that was September last year. Obviously, we've also had like the barbershop life on men's health as well. But the main one that we're talking about today is like screening for life. So we had collaborated with PCNs, where we engage with the communities of PCNs, because primary care network of they have like 5-6 surgeries under one roof. So from that was that we sent out screening messages out to the communities within the 3 PCNs that we collaborated with. And then from there we had a presentation from one of the doctors about cervical screening and how important it was. And from there, you know, there's been referrals, or even we've tried to engage with through the PCNs as well, in Urdu as well. We had one just after Eid, the Eid that just gone past, and that was with one of the PCNs, and we'd had that in Urdu as well. So that was just to engage with the communities if they don't understand the purpose or the awareness of it, you know, how important it is to have.
Yeah, of course. Yeah. Excellent. And that's more, as we said when we talked about age groups, that's more kind of the older age group. So maybe if you're listening to this today, that would be something for yourself. But it may be that you have younger children, school-age children, and actually there's all this information being given, or they've been given a letter at school or a leaflet about something like the HPV vaccine, and you're not really sure what that is, if it's relevant to them. And maybe you have some questions. So can I hand over to Christina and Becky? So firstly, if you can let us know actually what is HPV and what the vaccine is, and what kind of information you can provide in maybe different languages, or to make it a little bit more accessible to those listening who may have heard about it but are not sure what it is or how relevant it is for their child.
Yeah, no, absolutely. So the HPV stands for human papillomavirus, and it's a group of viruses that can lead and cause cancer. There's lots of different strains of HPV, and the HPV vaccination covers 9 of those strains, of which there are some of those specifically that target the cancers that women experience. The HPV vaccination is offered to all students in year 8 and up, but it's never too late to have the vaccination. So if you've got young people who are older than the year 8 cohort, please do come through to a clinic and catch the vaccination, because you're more than welcome. And it's available for women up to the age of 25 for free at our community clinics. The vaccination is just 1 dose. It used to be 3 doses, then it came down to 2, and now 1 is deemed to be sufficient to cover you.
Excellent.
Which is really, really encouraging.
Yeah.
With it being only 1, you don't have to have it a couple of times anymore.
Yeah. And you can just turn up at one of these community clinics. So where are the community clinics? Where do people find
So we
them?
have community clinics in lots of different places, which we can definitely share with you, so that you can tagging or with this goes out. But we have community clinics in Dessauer Road, in the community centre. They're all well advertised, so lots going on. The Luton Irish Centre as well. So all sorts of places that we have them, and they all get advertised. We have bookable ones and we have walk-in ones, so it's accessible to everybody on Saturdays during the week. So yeah, if you're missing your HPV vaccination, please come along. But it's a safe and effective vaccination, and it's done some really great things for the length of time it's been going on. So it's been a vaccination that's been available for females since 2008.
Wow, I didn't realise it had been that long.
It's been a very long time, and it's actually done some really good work.
16 years.
Studies have shown.
If that's my quick maths.
Those women that actually had the vaccination, women now, but were girls when they first had the vaccination, the rates of cervical cancer that's been detected in those females now has dropped by 90%.
Wow.
So it's an amazingly effective vaccination that has great results having it. So yeah, no, it's brilliant. It's absolutely brilliant. It's one of those ones, I mean, our colleagues in Scotland, I looked up last night actually, for those that had the vaccination at 12 to 13 years old, when they've had their screening, there's no HPV related cancers been detected in that cohort of people in Scotland who had the vaccination at 12, 13. So that is really, 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 really good.
That's really, really good. And actually, what about side effects? So people are always worried, I'm gonna take something. Am I gonna have any side effects?
So yes, I mean, the vaccination for the girls has done an amazing job. And also the boys, for males, the vaccination came in 2019. And so from this September, it is available, because it's a smaller group of people, from year 8 up to year 13. So again, if anyone's missing, please come forward and have the vaccination with us. But yeah, it's a brilliant vaccination, really important, and it's just unfortunate, and Christina can probably talk a bit more about the uptakes, that the uptake has decreased over the years, which will result in there being more cases without that protection. So yeah. So
we'll talk about that in a second, but any side effects to actually having it? I mean, obviously you have to have an injection. But, nothing in life is pain-free.
Nothing in life is pain-free, and nothing is 100% risk-free. The most common side effects are, as you do with any injection, sore arm, you might have a little bit of a headache, but the headache, a temperature, you might get a headache, a temperature, but that is a good thing, because that means that the vaccination is being noticed in your body and is starting to work and do what it's meant to do. Some people will have a bit of an achy arm. Obviously, as we said, there's no nothing that's 100% risk-free, and a very, very small amount will have an anaphylactic reaction to the vaccination. But when you look at data over a 5-year period from, I think it was 97 to 2003, I didn't mean that bit.
Well, I mean, allergic, very severe allergic reactions are very, very, very rare.
They're very, very rare. Very rare.
So, usually, unless you've had a very severe allergic reaction before, we always tell people what things to watch out for. That shouldn't be something to stop people having it. But
no,
if you have any
it
concerns, definitely to
to
discuss that.
Yeah,
now,
there's been hundreds of thousands of doses that have been given up and down the UK over the last year.
Yeah, and they've all been fine. So I guess, Christina, the main question that I know I hear whenever we do these community events is people always ask, why are you giving it so young? It's not relevant. And, my child is not going to be having sex for many, many, many years. So why is this relevant to us?
So that's a really important question, and it's something that we in public health are really passionate about. So with any vaccine, if a vaccine trains your body in how to react to an infection, and the vaccine schedule in the UK is one of the best in the world. And the reason that it is because it is really highly regulated. The Joint Committee for Vaccination and Immunizations are really strict and stringent on giving vaccinations when they do the best protection and are required for that stage of life. So they know, and they have the evidence has shown that given the vaccine in the ages year 8, year 9, gives the best form of protection to the students, and it gives the body time to learn how to fight HPV should it ever come across it in the future. So it's really, really important that it's given in line with that UK schedule, which has, been looked at very carefully as to when is the best time to give vaccinations.
Because HPV is actually very easy to catch, isn't it? I always tell people it's very, very easy to catch, and it's not just from having sex.
No. That is very true, and it's close personal contact is the way it's defined in the medical book. So what does that actually mean? Well, close personal contact, it doesn't have to be penetrative intercourse. It could be close proximity, close personal contact with somebody. It could be sharing of towels and sharing of linens if the virus was in high concentrations. But I suppose the other point to note is it's not about just a risk to the cervix. HPV does cause other cancers. HPVs cause cancers, they cause cancers in the penis, so penile cancers, larynx, voice box, the throat, the salivary glands. You can have head, nose, throat cancers as well. So there's a whole,
things like genital warts as well. So even if it's not kind of cancer, it's lots of things that actually are, completely unnecessary if we have something that can help. Unavoidable,
and that's the thing. These are vaccine preventable infections on a whole, which is why Scotland has been able to showcase how they do not have incidences or cases of the cancers in the cohorts that were protected, but there are obviously additional cohorts who weren't protected or who may have missed out on protection. So, it's important that we utilize this vaccine for the purpose it was given to us for, and that is to prevent cancer.
Yeah, and I think that's really clear. Thank you. And I think it's just really important to just drum down that actually it is relevant for everyone. You don't have to have been sexually active. It's not implying that you are sexually active or you will be sexually active soon. You can have HPV even if you've not been sexually active or not had a new partner for years, or and this is just something that can help protect you. So we're coming up to our first break, well, our only break, and we've discussed a lot. So we've discussed a bit about what HPV is, the importance of the vaccine, but also the sexual health clinic. So, and we'll go into a little bit more detail about both of those things and other different services. But are you able to get the HPV vaccine at the sexual health clinic, or do we have to go through to one of the community clinics?
So good question. We do offer the HPV vaccine to certain groups of people here at the clinic. I can give that information out here if that's appropriate. It is mainly for men who have sex with men and trans women and non-binary people between the ages of 15 and 45. So those are the people that we offer the HPV vaccine to free at the clinic, and we can discuss HPV vaccinations and how people can be assessed through maybe our Drew, who's one of our outreach leads, or just by coming into the clinic and having a chat. But that's who's eligible to access that service from us.
Excellent. And if anyone else can go to the community clinics, and we'll make sure that we'll link those to the ones that Becky was discussing earlier. So if you have any questions, do check in after the break, where we'll be talking a little bit more about the HPV vaccine.
Assalamu alaikum, this is Atif Nawaz. Listen to Inspire FM shows in your time by heading over to inspirefm.org or listen on Apple Podcasts or Spotify.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, and welcome back to the Health and Fitness Show on Inspire FM. I'm Dr Amna, and before the break, we have been talking to 4 very inspiring women who are doing lots of great work in public health in Luton to help improve knowledge, understanding, and uptake of different vaccinations that are helping women's health in Luton. So if you missed part of our show, then you can catch us online on the Inspire FM Facebook or YouTube page, or listen to the podcast on the Inspire FM website, inspirefm.org, or the new app. So just before the break, we were talking about the HPV vaccine. We talked a little bit about what it was and who is eligible for it. And you may, if you're eligible for it, or if your child is eligible for it, because we were discussing about it being given in schools for year 8, is that right? We said about year 8. But if you've missed it in year 8 for whatever reason, maybe you didn't, you're listening to this now and we've answered some of your questions and now you're happy for your child to have it, it's okay. You can contact either through the school or the community clinics to get that. Even it's never too late, as Becky said. So you may have got a text from your GP surgery or from community services telling you about this, and it might kind of be a little bit out of nowhere, and that can kind of cause quite a bit of distress to people, can't it, Anjuman? If they're not sure where they've got this text from or why, or is it just to them or whoever else, right?
Yes, that's right. Yeah.
But you, within your role as a community connector, you explain, you go out into communities and talk about this, don't you?
So we actually go out to the communities, sort of creating awareness with collaboration with the GPs of Luton. So there's programs that we have, screening program, which we did have in May, and that was to reach out to the communities, giving them a bit more of an understanding of cervical screening. So it was like a presentation done by a doctor. That's what we've done, and the messages go out to people through their texts, through their GPs, and a lot of them do get confused at why they're getting those messages. But I would advise that it's important that you do go to these programs that are put into place, because we want to hear from you. We want you to know how important it is. If you're detected, or like the virus is detected sooner through your smear test, then you're treated and you're saving your life.
Well, actually, you've just mentioned smear test, and maybe one thing we've not been clear on yet is the link between all of these things. So is anyone involved in smear tests and want to talk to us a little bit about what that is, what cervical screening is?
I'm happy to give a bit more information on
thanks,
kind of the benefits of cervical screening. So cervical screening is a national screening programme run by NHS England through our GP surgeries, and people with a cervix from the age of 25 to 64 are eligible for cervical screening. And they routinely get called via letter, but yes, text messages do go out as well. So it's always important that your details are up to date, because you should get notification through both of those measures. And I suppose the important thing about cervical screening is that it picks up changes or anomalies on the cervix, which could be caused by HPV, but also cervical screening can be caused, has other risk factors such as smoking. You can have a genetic link to cancers as well. So the HPV vaccine is really great at giving protection, but equally it's very, very important, even if you've had your HPV vaccine, to still go for your cervical screening when you are called. And again, it's usually every 3 years, but they can be shorter if something was detected, or if you were asked by the GP or to come back sooner. So it's really important to attend when invited.
Yeah, exactly. And people often, because in our surgery at the moment, it's usually the nurses that do the cervical screening, but I do get a lot of questions, and usually the question is, I don't know what to expect. It's going to be really scary, it's going to be really long. And what are your thoughts about this? And maybe kind of Sophie can help with this as well, because I'm sure you get that a lot with the sexual health clinic, because people don't know what to expect. It's not a test that you have every single day, and that can cause a little bit of fear, can't it?
Yeah, absolutely. I'm really glad we're talking about this, because this is a topic very close to my heart. I love speaking about cervical screenings, and I really encourage all of my friends and people that come into the clinic who have never had one to go and have them done. But absolutely, as with any intimate procedure or examination, it can be really daunting, especially if you've never had one before. A lot of the time, people with a cervix, they haven't had an internal examination, and the cervical screening is their first one. I think it's really important to remember that, and this is what I always say to young people, especially, these are professionals who see these things every day. They deal with it every day. There's nothing to be
I do whole clinics actually, and usually the nurses as well, who are very, very experienced and have done hundreds, maybe do hundreds in a month. It is literally just one after the other, and for us it's just a procedure, isn't it?
Yeah, it's just a procedure, and they are often very quick. They can be uncomfortable. I think it's important not to diminish people's experiences of it being uncomfortable. It's not going, but it shouldn't be painful.
It's not, I always kind of say it's not going to be pleasant. You're not here for a spa treatment. I'm not doing your nails. We are doing an internal exam, and I am having a look inside. But actually, we try and make it as uncomfortable as least uncomfortable, not uncomfortable, as comfortable, that's the word, comfortable is the word, as possible. And like you say, it's usually very quick, and most of the time people say, oh, well, was that it? Why was I worried?
And I think, like, what I always encourage people to do if they're not able to access the internet or things is to talk about it with their doctor or a nurse first and ask what exactly is going to happen. And most of the time, like you were just doing there, Amna, is the person doing it is going to be talking you through it. So they're going to be telling, okay, I'd like you to lay your legs like this. Now I'm going to insert a speculum, or now I'm going to put lubrication on the speculum to make it, slide in easier. So somebody's talking you through the process the whole time. And I always encourage people to, if they have questions or they feel uncomfortable or if they're in pain, to tell the person to stop or to ask the questions. They can go at their own pace. It doesn't need to be like, in and out. It's for them, and they can, make it as comfortable for themselves as if they want to as well.
No, definitely. And also it is just like you say, it's having that information, but also getting the correct information. And that's why events such as the ones that Anjuman helps run are really, really important, because if you talk to Brian down the road or Susie down the road, who had a different experience, you may not get that proper kind of medical knowledge. It might come from even with the best intentions, but everyone has their own kind of preconceived ideas. They have their own tolerance of pain. They may have had a really good experience. They may not have had a really good experience. And there could be many reasons for that, but just making sure that you get that correct information is really, really important in a safe space, isn't it?
Definitely. And I think, we're women here today talking about this. I know when I went for my first cervical screening, I had a good detailed conversation with my mother, who, was able to relay things like, if you have, for example, if you have a tilt in your cervix, if you tilt your pelvis, it makes it less painful. So that was great that I was able to have that open and honest conversation with somebody that I trusted.
And how amazing is that? And that's the position that I want us to be in, because not everyone can talk to their mother. Not everyone has a mother that is, able or available to talk about these things. But actually, this is why it's important to have not just women, but people talking about these things all the time, so that it feels like a safe space to ask those questions, to kind of say, well, I'm a little bit worried about this, or I have heard when I, had a baby or whatever, that I have a tilted, womb. Will this make a difference? What can I do? And normalize having these conversations, because actually, the more that we don't, then there's all this fear, and then there's a lack of knowledge that's just kind of going around, and then people miss out on something that's really, really important. Excellent. So, okay, so hopefully that has given us, a good overview of the link between kind of HPV, why you then have to go for your vaccine, and then your cervical screening or your smear test when you're invited. But I know at the moment there's been a lot in the news and locally as well about not just the HPV vaccine, but different other vaccines, because unfortunately here in Luton we struggle with vaccine numbers and vaccine uptakes. And one of those at the moment has been measles, because there's been lots and lots of cases of measles in Luton, in London. So what can you tell us about that, Christina?
No problem. So yes, unfortunately, Luton doesn't perform very well in a number of different vaccines. So the likes of HPV didn't quite recover after the COVID-19 pandemic. We continued to see low uptake rates. So the uptake rates were much higher and fell to about 30%. So that meant only a third of our population were protected. Now, obviously, we have the catch-up element, but it is quite concerning that 2/3 of our young people are at risk for not being able to have their HPV vaccine. So hopefully, this program will go some way to improve, people's understanding and catch up. But you're right, the measles situation nationally is quite serious. There have been areas in the UK, such as Birmingham, London, which have had areas of widespread transmission. And predominantly those have been among communities and people who have missed out on the MMR vaccines, so measles, mumps, rubella vaccine. And unfortunately, you need 2 doses of the MMR vaccine, one at 1 year old, and the second one then at 3 years, 4 months. And for, I assume, a variety of reasons, it is that second vaccine where most people either forget or miss, and that puts children, just as they approach school age and nursery age, more at risk, because they're coming in contact with other children. With infections like measles, they spread very quickly. So for every unvaccinated child, they can infect up to 15 other unvaccinated children. And there's a 21-day isolation period that goes along with that. So that would be very difficult for parents and for schooling, etc. So the easiest thing to do is to have the vaccination. It protects you against this vaccine preventable disease, but it also safeguards, should you be a contact of somebody who has measles, you then don't need to isolate for the whole 21 days. There's a different exclusion period for that. So that's a big difference for people.
And I mean, we are not too far out of the pandemic, and we remember what true isolation is, and nobody wants to go back to that. But also nobody wants to, catch measles or be spreading it to that number. I didn't realize the number was quite that high. So it is really, really serious. And I think we need to also acknowledge and maybe address the fact that there are lots of people who missed out on getting the MMR vaccine many years ago because of essentially incorrect information about its links to autism.
Correct, 100%. And that GP, Andrew Wakefield, who was a British practicing GP, was actually struck off the register in the UK and hasn't been allowed to practice.
And absolutely completely discredited.
Absolutely. And he did not peer review, so he did not get colleagues of his same level of or even higher training to look at his study. And when it was repeated, it was found to be wholly untrue. Unfortunately, he emigrated to another part of the world. He's over in America. And there's a different health system, as we know, in America. And with media and social media, messaging very quickly travels now. You don't need to be, in Luton to hear information from Andrew Wakefield, who's currently residing in America and still, unfortunately, pushes the narrative of the link. But I'm very glad that we have this platform with you, Emma, to actually talk about this and actually refer people to trusted information on the NHS, on the vaccine project website. The Oxford University has an independent website where it talks in great detail about vaccines, and I'm happy to link your listeners to that because it's really easy to understand in ordinary language for the everyday person. And the NHS has a number of resources in multiple languages, Urdu, Punjabi, Bengali. So, don't worry, we'll link all those for your listeners because we are aware that we need to get information out in more than just English.
Anjuman, any thoughts about kind of what anyone from the community can do if they're listening and they realize that this is a problem within their family, within their circle, within their community? Anything more that we can kind of be doing? Because I think you mentioned earlier your role is to be the voice of patients who sometimes don't always aren't always heard or don't always feel that they have a voice. And this is a platform that people do listen to and hopefully get some benefit from. And we want this to be a two-way thing, that actually if people have suggestions or things that we can be doing to help the wider community's health, then we want to be doing that.
So it's important that not just cancer, but any services that they're facing or any sort of where they're not being heard, we do have our website. If you've got something that you want to share anonymously as well, you can come onto the Luton Borough Council website and look under Macmillan Luton Cancer Connectors. We've got the I'll say the cancer connectors at luton.gov.uk, so we'll probably add that to the link as well. And reach out, tell us what your experiences are. Are you facing, what is your concerns, within the services within Luton, whether it's cancer or any other services like the injections, vaccinations, anything, so that from your voices, we can make changes. We can take this further. Thank you.
Thank you. And I think that leads us really well to, because, everyone, I know Luton as a whole community, we all care about each other and we do want to help and support each other. And I think nobody wants to help and support anyone else more than, parents want to support their children. And we are coming up to September. We're coming back to hopefully very soon. I keep hearing from parents of school-age children that they can't wait for them to go back to school. But what steps can parents take to protect their children, and what information should they expect to kind of be hearing when they go back to school with regards to vaccinations and that kind of thing?
So within Luton Borough Council, we're very keen to support national campaigns, and one national campaign which we really like to support is that back to school, back to nursery, back to university campaigns. So one of the key things parents can do is make sure that their child's vaccines are all up to date, because unfortunately the autumn winter season is the season for spread of infection, coughs, colds, and everything in between, chickenpox, scarlet fever. So unfortunately we don't have vaccines for everything, but those illnesses that we do have vaccines for, we'd really encourage parents to speak to their school immunisation team, attend the clinics when invited, either in the community or at school, or speak to their GP if it's more convenient for them. And I know we've spoken a lot today about lots of different illnesses, vaccines, etc. We also have in Luton our Luton Family Hubs, and that's a new network that has been set up in recent months that brings all of this kind of information on children and young people together. And there is a whole section on vaccinations, but there's everything from toilet training, all the way to, complete school readiness. There's what else is going on in Luton, babies, weigh-ins, etc. So I'll add the link to the Luton Family Hub's website, which is accessible through the Luton Council website as well. And they also have newsletters I know they're sending out at the moment, so you can always sign up to a newsletter and keep an eye on what's going on in your area.
And actually, that's a really thank you for bringing that up, because I was looking, I don't know if it was kind of on BBC News or something in the news, that actually at the moment there's a really big campaign happening, because a lot of children are apparently going to school and are not toilet trained at all, which is already kind of putting them at a disadvantage if they're still in nappies. They're focusing more on that rather than kind of the schooling. And that would be a really good resource. So maybe actually that's an idea for another show, and it'd be good to hear from our listeners to know if that's something that they would kind of benefit from, of us talking about how to support with toilet training. It's good that resource is available via the family hubs. Becky, you also kind of deal with kind of going back to school and the programs as well.
Yes, so we'll do any vaccination. We're not shy. So we obviously have clinics where you can come along for your HPV. So teenagers more than welcome. We have clinics for under 5s as well. So and the age group in between that. So any vaccinations that you're missing, you still can go to your GP to catch those up. But we also have community catch-up clinics, which are walking or bookable, and just arriving. So yes, we'll provide you with the link, but. Every first week of the month, there are walking clinics in various children's centres and family hubs, and other places in Luton where you could just walk in and have any up-to-date any vaccinations that you're missing.
Excellent, thank you. That's very, very useful. So we have covered a lot today. I think we've segued from HPV to cervical cancer to school age vaccinations, and actually school age support. And I think thank you all so much for being here and for sharing your expertise. And this is kind of exactly what I wanted this show to be about, because actually these things don't happen in isolation. It's not about kind of getting one vaccine or going to one visit and then tick, it's done. Your health is a life journey. It's a life course, and actually we do have to keep going back, updating ourselves on information, seeking the most up-to-date information. And maybe if we've made a decision or are concerned about something, that we revisit that and just make sure it is still relevant and the best decision for us. So we will make sure that we link all of those links that we have discussed below, and make sure also that we share the information about where the community clinics are and the family hubs. But in the last 2 minutes of the show, is there anything else that anyone wants to add before I thank you all for your time and expertise?
Yes, I'd like to just mention that on the 28th of September, we're doing a World Cafe, Macmillan Cafe afternoon. It's a day at Choyland Lane Community Centre. So it'd be good that if anybody wants to come along and have a chat with us, and our public health team will be there as well. That would be it would be between 12 to I think 4. But look out for any sort of posters through the Luton Borough Council or anything amongst your community faith centres, and that look out for posters. That I would like to sort of mention that.
Great.
And
thank you so much.
And also, we just want to hear your journey. So please share your experience so that we can shape the NHS services and cancer services in the future. Thank you.
Thank you so much.
And I suppose a final word from me on vaccines is vaccines are the second most important public health invention after clean water. So, that is quite a title and an accolade to have.
Yeah.
So linking back that we don't have vaccines, they're not cure-all, they don't prevent or stop everything. We still need to have really robust hand hygiene, wash our hands, look after our health, be healthy, have exercise, take medications as we're supposed to. There's a whole raft of prevention that we need to do as people. But other than clean water, it's quite powerful to know that vaccines are that good at preventing ill health.
And to be honest, there is nothing more that I can add to that. You've just summarized everything amazingly. And, if you've just listened to the last kind of 30 seconds of the show, that's your take home point right there. Thank you all so much for joining us. We will make sure we link all the links below. And I look forward to hearing any feedback. Assalamu alaikum.
Thank you for listening to our podcast. Why not tune in to our live stream at inspirefm.org and follow and subscribe to our social media platforms at InspireFM Luton.